Well, I'm not going to break out in song, but happy birthday ACA. 30 years since the UCA and the then ACA joined forces to become the Chiropractors Association of Australia.
In looking at the resources that we had as a profession, it just seemed to me that here we were dividing our numbers and finances amongst two different groups, often at loggerheads with each other. And it seemed, after working with the UCAA executive for quite some time, it seemed to me a very logical thing that we should surely join forces, create a single voice.
So I was the president of the ACA at the time that the discussions of the merger started.
The whole concept then just started to meld together, and we were bringing all these people together, bringing all these ideas together.
ACA and UCA actually got together, had a joint conference. That was then I thought, hello, the ground is shifting.
We had our AGM, would have been in September or thereabouts, and I think we had an extraordinary meeting and voted.
So the initial co-chairs were Dr. Paul Searle from Tasmania and Dr. Ed Devereaux from New South Wales.
When it went through, it was a really exciting thing. I think the thing that stands out for me is we're a small profession. You know, in the greater healthcare landscape, we're a small profession, and I don't think we can afford to sort of divide things down. We need to work together to be able to have good outcomes for the community. So I was excited about it at the time.
John took over as the CEO or the executive director from day one of the CAA. He was already the ACA, and we had him appointed as then. I was the national secretary, so he was, 20 minutes away, and we'd meet up there.
Robert Scott was president for 4 years, and he finished up his presidency in 1997. Whoever you spoke to that had been a patient of his, they always loved him.
Bob was a visionary, and he had this vision that he wanted to make sure that we would be a unified body, and that's what he worked towards. He saw his role, I guess, as making sure that these two bodies stayed together and stayed together as one group.
So right from the early 90s, we saw the CAA really involved in politics. In 1993, it was the Chiropractic Fight Back response, which was a response that emanated out of a document very critical of chiropractic.
It was widely distributed to politicians, to health funds, to third-party payers, etc., and it was well received.
That was probably the first time that unification really came to the fore, because we didn't just sort of join hands and shake hands, we fought together.
We had an Australian celebration of the 100-year centenary of chiropractic in 1895, and we did that in Canberra because we were going to produce as big a splash as we possibly could, and hopefully get some press and speak with the politicians, etc. And so it was a big conference. A lot of effort went into it, and it went over really well.
What I love about Guild Insurance, there's a relationship there going back at least until 1996. What they've fabricated is a prime insurance product, an insurance product that covers you for everything a chiropractor should be doing, coupled with excellent representation who have done it before. I've done 380 odd medico-legal reviews now, and the difference between a chiropractor who is represented by Meridian lawyers, insured through Guild Insurance, and what you get as an alternative from other insurers and other representation firms is vastly different.
So back in the late 90s, I was actually on the Victorian board of the CAA, and also had some involvement at a national level, but not on the board. And one of my big things was public education. And this is really where we started the whole backpack campaign. I can remember doing a backpack program at Middle Park Primary School. This was the first of its kind for chiropractors and had enormous support. It was one where we basically sent a message out to the media, said we would be there, and hoped that they turned up, and they did. It was a great start, and really it was the association supporting me and other chiropractors who were keen to do something for the profession that really made the difference.
So again, happy birthday.
Happy birthday.
Happy birthday.
Happy birthday.
Happy birthday ACA, onwards and upwards from here.